Laser is an acronym for light amplification by the stimulated emission of radiation. The history of laser can be traced back to Albert Einstein. He described the concept in 1917, but it wasn't really until 1960 that the concept became a reality. There was immediate interest and recognition of the vast medical applications. Over the next 25 years, constant advances in technology led to increased use in the medical field.
The move to aesthetic applications began with a new generation of lasers capable of selective targeting for tissue abnormalities. In the 1990s, the integration of computerized controls further increased the precision of lasers and broadened their applications and appeal in cosmetic procedures. Demand was at an all-time high. From removing unwanted hair and leg veins to rejuvenating skin and reducing wrinkles, lasers have become an indispensable tool for cosmetic services. A laser is a device that produces intense beams of pure colors of light, usually converting electrical energy to light energy. When the skin absorbs the light, it converts it to heat energy. The heat damages the targeted cells while leaving surrounding tissues unaffected. The scientific term for this is selective photothermolysis. Lasers come in different wavelengths, or colors. Different wavelengths interact differently with targeted structures within the skin. The effect the light has on the tissue is also greatly impacted by the other operating parameters of laser light, including pulse duration, fluency, and spot size. It's the combination of these parameters that determines exactly how a laser works.
Laser classification is an indication of the beam hazard level of a laser or laser system during normal operation. The laser classifications are represented by a number or a numbered capital letter as shown in the following diagram. Class 4 lasers are considered to be the most powerful in these classifications and consist of both direct beam and emitted light, which are harmful. These are used for laser hair removal and have military applications as well. Class 3B lasers are harmful due to direct viewing. Class 3R lasers should not be directly viewed as well and are typically what is used for laser scanners in copiers and printers. Class 2M lasers are safe to use, but cannot be deliberately looked at. You would find these types of lasers in pointing devices or laser spotting devices. Class 2 lasers are generally safe to use but should not be looked at directly. Class 1M lasers are safe for normal use, but when combined with the use of other optical equipment such as magnifying glasses and telescopes, there will be an increased risk. And finally, Class 1 lasers present no real harm in viewing and are used most commonly in grocery store scanners. Protective eyewear should be placed outside the door for anyone who needs to enter your treatment room or area. Everyone within the room or non-hazard zone (NHZ) needs to have goggles with proper filter of the wavelength being used. For example, you should see a listing etched on your protective eyewear with the OD or optical density listed in a wavelength nanometer range as shown here. Optimally, there should be no windows in the treatment area, or at least, windows with protective, non-reflective coverings. A grounded electrical outlet with proper amperage and voltage ratings for your specific laser, with its own dedicated circuit breaker. There should be no mirrors or reflective surfaces in the treatment area. This would include any personal attire items or other objects that may errantly reflect the light of the laser and become a safety hazard for the technician or patient.
There are two types of laser colors and wavelengths with the following attributes. Monochromatic is defined as having or consisting of one single color or wavelength. The other is polychromatic attributes, which are characterized as having or consisting of multiple colors or wavelengths. Note the difference between these two types by comparing the diagrams beneath each description. The next two wavelength definitions to note include coherent versus incoherent, and you can see in the first diagram that coherent is a beam of light characterized by a fixed phase, a single wavelength in phase with one another. In an incoherent wavelength, we find scattered light not in phase with one another, with multiple wavelengths. Our next observation is for comparing laser light to regular light sources. Laser light sources are always a single color because waves are the same length and because waves are parallel. Light stays in a tight beam for long distances. This is referred to as a collimated beam. Regular light sources, on the other hand, have many colors or wavelengths mixed together. The light waves spread out as they travel. In this slide, we will look closely at how light absorption varies in rates and intensity, noting that the greater the light absorption, the more energy will be deposited. The graph illustrated here will show you the absorption rates of melanin, blood, and water across the light spectrum. Let's do an overview of these various absorption types. We'll cover melanin absorption first. Recall that melanin is the pigment responsible for the color of human skin, hair, and eyes. It absorbs light strongly in the ultraviolet, also referred to as UV, and visible regions of the spectrum. This absorption is what helps protect the skin from the harmful effects of UV radiation by converting it into heat. Note the next example of blood absorption, specifically hemoglobin within red blood cells, where light is absorbed most strongly in the blue and green regions of the visible spectrum. Conversely, it has relatively low absorption in the red and near-infrared regions. Next, we'll note the example of water absorption, whereby water molecules absorb light strongly in the infrared part of the spectrum. This absorption increases as you move toward longer wavelengths, as in a far infrared region. Water also has some absorption in the ultraviolet and visible regions, but it is less significant compared to its infrared absorption. In conclusion, note that the absorption properties of these substances in the light spectrum have various implications in fields of dermatology and laser therapy, as they can be used to target specific tissues or conditions based on their absorption characteristics.
The pilosebaceous unit structure consists of the follicle, hair matrix, internal and external root sheaths. Structure of the hair, cuticle, cortex, medulla include the following: dermal papilla, erector pili, and sebaceous gland. Take a moment now to review the diagram shown here. In this, the anagen phase, the technician will achieve permanent hair removal. The laser will be attracted to the dark hair following down to the papilla, which is attached to the blood supply. The laser will heat the hair and the papilla, destroying the vessel attached. The destroying of the vessel will permanently destroy the hair follicle, and this can only be achieved in the anagen phase. In the catagen phase, the papilla separates from the blood supply. The hair follicle will be damaged in this phase, but not permanently. The laser light will stop where the dark pigmented hair stops, not reaching the vessel. Destruction of the vessel is crucial in order for the hair follicle to die and prevent growth of another hair. In the telogen phase, the hair is completely unattached from the papilla and the vessel, and the hair will begin to shed from the skin, with no damage at all to the hair follicle. It will return to the anagen phase, at which time the technician can permanently destroy the hair follicle. The early anagen phase of hair growth is the initial stage in the hair growth cycle. During this phase, the hair follicle becomes active and begins producing a new hair strand. Cells in the hair follicle rapidly divide, leading to the formation of the hair shaft. This phase is characterized by rapid growth, and the new hair strand pushes out the old one. This can last for a few weeks to several years, depending on factors such as genetics and hair type. The hair is actively nourished by blood vessels, which supplies nutrients for growth. In summary, the early anagen phase is the beginning of the hair growth cycle, marked by the active production of a new hair strand with rapid growth. Let's review one last time the 3 stages of hair growth as it appears in the diagram below and that has been covered in this section, showing the anagen, catagen, and telogen phases.